IoT-based solutions for monitoring asthma patients. Asthma is a long-lasting chronic inflammatory lung disease that cannot be cured, only controlled. Symptoms control include awareness of triggers, regulatory of medication intake, and monitoring the peak flow levels. Internet of Things, IoT, is one of the major communication advances in present time. There has been a major initiatives and work around mHealth in different healthcare sectors. More recently, a new concept is the MIoT and it has been introduced. Networking technology enable IoT devices to communicate with other devices as well as with applications that are running in the cloud. Problem definition. Asthma patients are routinely exposed to harsh environments like dangerous gases in the air, dust, smoke, monocarbon dioxide and more. These factors harm patients without them being aware of it. Uncontrolled asthma can lead to excessive use of the rescue inhaler, which then leads to them gaining immunity to the medication, which leads to them increasing the dosage, which then has various side effects on them. Problem significant. The number of asthmatic patients around the globe was estimated to be around 334 million in 2014 according to the Global Asthma Report. However, that number increased to 339 million in 2018 according to latest figures. The accidental death rate due to the disease is 1 in every 250 cases per year globally. Also, the monitoring of patients is insufficient since patients do not monitor their symptoms. Their data is manually written and have long periods of non-communication with their doctor. Below, as you can see, physician awareness of the standards of the national guidelines in management of asthma. Met guidelines are 39%, whereas guidelines that are failed to meet are a whopping 61%. On the right, as you can see, asthma management in patients is controlled only 5%. It's partially controlled by 31% of people, and it's 64% of people it is uncontrolled. Proposed solution. As a result of understanding the severity of the disease, we plan to create an IoT-based solution to monitor asthmatic people, notify them when an attack is expected to occur, and notify them when there are some harmful air factors such as dust, smoke, and around them. We're going to start with attaching a pressure sensor to a tube that will be provided to the patient to measure their ability of exhaling air out their lungs. Next, the pressure sensor will read the air pressure and send it to the readono that will send readings via a Bluetooth chip to the patient's cell phone. Creating a prototype for a system to monitor PEK levels in asthmatic patients and detecting the harsh environments that surround them. The system will have 4 main phases. Number 1, the sensor contains the environmental sensors and PEK sensor. Number 2, a microprocessor, which is used to process the data that has been detected by the sensor. Number 3, mobile application that interacts with the patient, the child's patient's parents, and the physician. And number 4, the IoT-based database used to store, access, and retrieve patient information. Requirements specification. Objectives. We will implement a smart application that keeps asthmatic patients from any life-threatening attacks at any time. Patients can take preventative measures to avoid the causes of asthma triggers and give accurate information to the surrounding environments that can help prevent life-threatening asthma attacks. We also aim to make them live a normal life like other people. System architecture. The user will have 2 sets of sensors, one to collect environmental data and one for the peak flow level. It's important to note that the peak flow level is a measurement of the strength of air that is exhaled from the patient's lungs. The data gathered will be sent to the Arduino microprocessor, which will then be sent via Bluetooth to the mobile application. The mobile application is then accessed by the user, the physician, and the child parents. If at any time there is an emergency, the emergency contact will be contacted via SMS in case of any severe readings. Finally, the mobile application will store data via Wi-Fi to the database on the cloud. Case diagram of the application. The physician and the patient are both capable of logging into their account. They can monitor and read history, and they can get notifications on any critical peak flow reading. They can communicate in the dialogue section and see if there's a next visit to follow up. In addition, the patient will only receive a notification when an attack is expected or if the environment is unhealthy. There are two flowcharts. The flowchart on the left shows the environmental conditions detection. It will start by reading the environmental sensor values and comparing it to the threshold set. If it is less than the system, it will take no action. If it is greater, the patient will be notified. On the other hand, when measuring the peak flow level, first of all we are going to start by measuring the air exhaled from the lungs. If it is below than 50%, all parties will be informed. This project aims to help between 50 and 80%. We highlighted the patient will be notified that trigger an asthma attack like dust, temperature, humidity, and dangerous gases, air quality. We integrated the peak flow measurements in the system for them to easily track their health conditions via Arduino UNO. All the sensors readings are sent to the mobile application via Bluetooth, which is manually connected on the application's GUI interface. All the unhealthy detections will be heard by the phone speakers via notifications. Moreover, all unhealthy detections get manually stored in the database.